Hello, welcome back to my channel. This video I'm going to be explaining a little bit of working as a PSW while you're in nursing school. So for those that are just starting out in nursing school, in Canada at least, we can work as a PSW when you finished first year nursing school, which is really great. It gives you a lot of experience doing basic care, and honestly it pays pretty well for being a student. So I'll get right into my experience of working as a PSW while in nursing school. So normally first year nursing school, it's a very big focus on the aging population, so people who are usually over the age of 65. And in non-COVID times, usually you do your clinical placement in a long-term care home or working with older people. Basically just performing basic things like washing, changing, hygiene, and things like that. So in Canada, being a PSW is basically someone who cares for others, and it can be in a long-term care setting or it can be in their home. So you help them with their basic activities of daily living. You need to have completed usually a PSW program or course. Sometimes it's 8 months, I think, or you can do first year nursing school. So as long as you've completed both of those or one of them, then you're fine. And in Canada, PSWs make anywhere between $18 and $24 an hour, which is really great. And it's good when you're a student to make that much an hour. So my experience may be different than others because my experience was in a pandemic, and I unfortunately did not get to do my clinical placement in person because of the pandemic, so we didn't really learn any of these skills. So when I got a job as a PSW, I was kind of just thrown right in there. Like, I basically didn't know anything. I'm not gonna lie. Like, I watched videos of it and we learned about it kind of in our courses, but we never actually got to practice it firsthand. So it was definitely a learning curve at first. So I'm going to talk about some of the things that maybe you should know if you're a nursing student and looking to work as a PSW. So I'll start off with, first, these are some of the things that you'll be doing. So you'll be helping with feeding. So some of the clients who have impaired mobility, they're not able to feed themselves, or if they have a level of dementia or memory issues where they can't feed themselves, then you'll be literally having their dinner and using a fork and knife and feeding them like that, or helping them drink. So this obviously isn't too hard, but you just have to make sure that they're chewing their food and the bite sizes are small enough that they won't choke on it. And just making sure if they can't talk that you're reading their body language to see when they're full or if they still want some more food. And it's not always that easy, because if they do have an impaired ability to communicate, it is difficult to know, is this person done eating or do they still want to keep eating? So I usually try to feed my clients until they're like, no, I don't want any more. Then I'm like, okay, good, now I know you're full. Secondly, you're going to be helping with dressing. So this part isn't too hard at all. It's a little bit awkward when you're doing it for the first time because you're just not used to being in people's personal spaces like that and seeing them in a vulnerable state. But honestly, just do your best to make them feel the most comfortable, and try not to go in there and like rip their clothes off them. Just kind of ask them like, oh, what do you need help with? A lot of the times women only need help undoing the bra at the back or helping to get the shirt over their head. So definitely don't try to overstep, and like try to feel the water before you go in, and just ask them like, what exactly do you need help with, and then they'll let you know if they can. Next, you'll be probably helping with personal care. So these things include brushing teeth, washing face, wiping for them, helping with showering. This part is, for me, a little bit difficult at first because I was so not used to doing this to anyone. So it's kind of just something to get over, and it is hard at first, but it gets a lot easier. Honestly, try not to stress too hard about it, because at the end of the day, like, they're still people. So you just ask them how they like to do things and what they need help with, and they'll probably be more than happy to tell you how they need help. So moving on to changing briefs. Now this is something that, to be completely honest, I never saw myself being able to do, and I'm like, oh my goodness, it's difficult, but it gets easier. I mean, the first couple times you have to do it, it's just very interesting. But honestly, we're humans, and I hope if I am ever in that point of life that somebody that's going to help me is going to be non-judgmental and is not going to make me feel embarrassed. It's just bodily fluids. Just remember to wear gloves. Luckily right now we can wear masks, which helps. Normally when you change a brief, you take it off and you help them with like a wet wipe, and you wipe their area and make sure it's clean, which is actually really important, especially in the older population, because they're more prone to UTIs. So if they're wearing a brief all day and it's soiled and they're literally sitting in it, it can definitely increase the chances of them getting a UTI, and UTIs in the older population can actually be really dangerous because it can lead to like a delirium, they can fall, it can lead to other infections, and it's just, you want to avoid that. So yeah, just you want to make sure the whole area is clean before you put on a new brief. Another thing you'll probably be doing is doing lifts. So you have a sit to stand machine and a Hoyer lift. So the sit to stand is a machine where they're kind of in a sling under their arms, and it helps them sit from their chair up to the machine, and normally you can go and put them on the toilet or you can move them into bed. That one is for clients who still have a limited range of mobility but might just need a little bit of assistance getting up. Next is the Hoyer lift. The Hoyer lift is for clients who cannot get out of the chair themselves or really get up by themselves, and basically it's a whole sling that goes underneath them, and the lift lifts them up and you can put them in the chair or wherever you need to. That one's a little more difficult, and usually you never do it alone. There's always going to be another PSW or nurse that has to help you with the lift, so that makes it a lot easier. So some things to keep in mind, and I think is super important, is just honestly treating clients or patients with respect and dignity. And I know that sounds so cliche, but I've seen so many PSWs literally go into clients' rooms with AirPods in, like headphones on, completely not talking to them, like just going in, doing what they need to do and leaving. And personally, I just think, like, how can you do that? You're going into people's personal spaces, you're going into their houses, you're seeing them in a vulnerable state, like you want to make them feel comfortable. And I want to be a nurse and a PSW that people are comfortable with, and I want them to like me, and I just want them to feel good when I'm giving them their care. So I try to make a lot of small talk with them, like ask them how their day is, ask them about the weather, like literally anything. Like they love to talk, so you'll end up like finding yourself getting lost in so many conversations, and you're just like, oh sorry, I have to go to the next person. But honestly, like that's probably one of my favorite parts of being a PSW, is that like you get to know your clients and you get to know what they like, what time they need care at, and just stuff like that, and it just makes it so much more personal. And I really like that. It's not just going in, performing your duties and leaving. It's like, oh, how was your day today? Well, how was your weekend? Or, oh, did your daughter come and visit? How was that? Like it's really nice. I like that. All right, next I'm going to move on to managing course load and working. So obviously nursing school, it's a lot of content, a lot of work, a lot of just extra things that I, to be honest, did not plan for. So working as a PSW is a good way to make a good wage while you're working, but you just need to be careful not to overwork yourself and overstress yourself, because you obviously want to do well in nursing school and you don't want to have to sacrifice any of your grades maybe for a job. So the part that I really like about my job is that I'm hired by a staffing agency, and I work solely at one retirement home, but I'm hired by the staffing agency that staffs that home. So it's nice because I only have a specific amount of clients that I see, and it's usually the same ones. So I can plan my day really well, and you get paid per client visit, and it's not, you don't have to be like, okay, 3 to 11 p.m. and you get paid for like those 8 hours. It's, you get paid per client and how much time is allotted to them. So it's actually really nice, and it works out pretty well when you think about how much time that you're actually there for. It's a lot less than having to go in, say, for like an 8-hour shift, because normally it doesn't take 8 hours to do a whole day's work of PSW work. So since I work as an evening PSW, I guess, normally you'd have like a morning one and an evening, and then some of them are overnight ones, but because they sleep at nighttime, they don't really need, it's not that busy. So you can work as one in the mornings, which normally you'd have to start at like 5 or 6 a.m. and you work until about 12, and you'd help them get up and get ready for breakfast, get dressed for the day. And then I work as an evening one, so I kind of help people get ready for bed, which is really nice. It's not too difficult. There's not a lot of showers usually. I think most people have showers in the morning. But it's pretty much just helping people put their pajamas on, reminding them about their medication, changing their brief for them, sometimes feeding dinner. So as a nursing student, it's nice because most of my classes are in the morning and the afternoon. So my shifts don't usually start until about 5 or 6 p.m. because people don't really need me until after dinner. So I pretty much have the whole day to do nursing school work, and then at nighttime I can go into work and work for about 4 to 6 hours depending on how many clients I have, and it works out really well. And lastly, I just wanted to highlight how this job is going to help you as a nurse one day. Although it may seem that you're doing like very basic things, and I feel like nursing kind of builds on top of the skills that you learn as a PSW. Obviously, if you're doing bedside nursing or if you're working in a hospital, you're giving medication and you're doing that stuff, but you're still caring for patients, whether they're like post-op or pre-op or in the psych unit, you're still kind of giving basic care and trying to help people with their activities of daily living. And probably the biggest thing that's helped me as a nurse, especially because I started my nursing school in literally a pandemic and didn't get to do my clinicals, is just being able to communicate with patients and their families in a warm, professional manner. And I know it sounds so like cliche or whatever, but nursing school tries to teach you this in a textbook and tries to teach you empathy and tries to teach you relational lenses and stuff like that. But honestly, you can learn about it and you can read about it, but it's not going to help you unless you actually practice it. And I think this type of job, like the people that you work with and the things that you do, it gives a really good opportunity for you to get to know these people really well and to be really warm and kind, and just like practicing small talk. Really, it helps so much with your patients and your clients that make them feel more comfortable when they're with you. So being able to walk into someone's room and ask them how they're doing or how their day was is a skill that I feel like is so important, because you don't want someone to come into your room and be really cold and just not friendly, because then that doesn't make the person feel good. But like just learning this skill and doing it automatically is going to help so much as a nurse that I'm already doing as a PSW. So I think that's just so important. And at the end of the day, I just want to be able to make my patients feel as good and comfortable and warm as possible. So I think learning the skills at PSW is one of the most important things. Alright, so this is just a quick video on my experience of working as a PSW while in nursing school. I hope that I've encouraged you maybe a little bit to look into this job opportunity while you're in nursing school, because I think it's a great opportunity. Like I said, the pay is good when you're a student, and it really helps you develop those fundamental skills and personality traits that you can later use when you are a nurse. So thank you so much for watching my video. If you have any thoughts about this or any other tips, feel free to leave a comment. I'd love to hear it. Or if you just want to let me know how you're doing nursing school, I would love to hear it. So thank you so much for watching.